Single stage direct implant reconstruction, we do that at the time of the mastectomy. Traditionally, breast reconstruction through implant reconstruction is done as 2 stages with tissue expander in the first stage, and then it gets expanded up, and then the second stage will put an implant in. But direct implant reconstruction is a single stage procedure, which we will do as well in appropriate candidates for the procedure. Single stage direct implant reconstruction, what's going to happen is the breast surgeon is going to go in and remove the breast tissue, generally leaving the nipple and the areola there, and we will place the implant held in place by something called alloderm, which is the cadaver dermis, and then the skin gets closed over it. And the risks of the procedure, aside from the general risks of bleeding, infection, and wound complications, there is a risk of a seroma, which is a fluid collection, which is because the alloderm and the skin have to adhere. They'll have the drains in to drain any fluid, but even with that, sometimes you can get non-adherence or fluid collections. There is a risk of asymmetry. If we're doing one side and matching it to the other side, or if we're doing both sides and matching them to each other, the difference between a single stage direct implant reconstruction versus a 2-stage reconstruction, tissue expander then implant, is in a single stage direct implant reconstruction, there's no plan to go in at a second stage and tweak and reshape it. So to some extent we say, you get what you get and you don't get upset, because this is how it's going to heal, and after we put it in, we have very little control over how it heals. So there is a higher risk of asymmetry, there's a higher risk of contour regularities where you can see the rippling of the implants. It can heal asymmetrically. So that there's a significantly higher risk of that when we do this in a single stage than when we do it in 2 stages. There's also the risk of adverse scarring, which everyone will have a scar. The only thing I can guarantee about the scars is that you're going to have them. So bear in mind that even though this is a single stage direct implant reconstruction, there may be a need for a second stage, a revision, if they do heal asymmetrically to the point that they're asymmetric. Lastly, the risk of direct implant reconstruction is the risk of implant failure. Failure is defined as anything that requires the implant to be removed. It could be from exposure of the implant, it could be from infection, it could also be from something called capsular contracture. Capsular contracture is basically where your body forms a scar capsule around the implant. Sometimes that capsule can contract and it can become distorted, and it could also become painful. Those are called capsular contractures. The risk of that is significantly higher in patients who've had previous radiation. But if it's significant and it's painful, sometimes we have to remove the implant.